All right. So welcome. So for those who are new to the call, please write your name, agency, organization, position, and the counties represent in the chat box, so we can have that for our records. Today's agenda consists of an agency spotlight. Today we have Charlene Artillio from Montgomery County to do their county perspective of BH Works. We've had the previous 4 SAP agencies in Montgomery County present on individual spotlights, and now we want to have the county do an overview of their experience from that perspective. We also have some updates for panels, along with a demo on some things, as well as we have our Marjorie and Payne will talk about the new additions to the BHOC website. We have some interactive polls for you to talk about, and we have our general group discussion for comments and questions. So with that being said, just to update things on my end, we're expanding as a collaborative. We've gotten, I know the pandemic was tough for a lot of us as far as expansion for our group collaborative. We have a lot of membership, and we're very happy that you guys continue to join these meetings. We have new faces coming in every month. We just want to keep growing this larger and larger. And as Payne and Marge will talk about, we're actually expanding those groups to other settings as well. So we may have some of them join one of these calls to kind of see it, but we have some other offshoots of this monthly call. Just to recap for some people who weren't here in the June call, these are just the percentages of screens done to date within the BH Works platform. And so, we've seen a higher increase in ideation. We used to have around 33% combined for ideation, 7% and 26% for history. And now we're up to 8% current and 33% lifetime. So we've seen a little spike in some of the other categories as well. And a lot of that we probably attribute to some of the increased effects of the pandemic. Just wanted to update you guys. So we brought this to your attention a couple months ago. With the situation things were back then, it might not have been the right time to think about this. But now, as schools are going back in person and some of the agencies have stabilized, I wanted to let you know about we have a accompanying, some of you have been part of the youth suicide prevention grant. We have an adult suicide prevention grant as well. And along with the sites that are utilizing as part of the new youth grant, we also have the same ability to be able to expand that to adults. And so for some of the agencies that have other components that serve adults, such as outpatient and crisis and things like that, you have the ability to expand your usage into those areas through our adult grant. So now that you're kind of more stabilized and staffing is kind of set up, if you're interested in any of these things, please contact me and we can start talking about how to get you guys set up in that manner.
Peter, let me just plug that a little more. There's really 2 avenues there. The adult grant really would like to see some more adult services.
Hey, you working Saturday?
Using Mark, you got to go on. Yeah, using the screening tool, outpatient program, substance abuse program, intake office at a health clinic. Really could be any could be a medical setting, could be crisis services. We've been involved with a lot of crisis programs that want to use the screening tool, both on the child side and the adult side. So we have the funding to expand the use like that for free for 2 years to any agency interested in doing that. As Tita said, some of you already are using BH Works. It'll be an easy expansion into another service. Some of you might be new to it, and we welcome your involvement in doing that. So we're looking to light up some sites for our SAMHSA at this new SAMHSA grant, and just hope some of you will be curious enough about it to reach out to Tita, and then we could set up a informational session. So thanks.
Thanks, God. So we'll start with our spotlight for today, and I will turn it over to Charlene to present.
Awesome. Thank you, Tita. And I'll preemptively say for anybody, if there's any like audio or tech issues that you're seeing on mine, like please interrupt and let me know ahead of time. It's been a little stop and go today, so sooner rather than later. But hi, my name is Charlene Artillio. I work in the Office of Mental Health in Montgomery County. I'm the Children's Clinical Services Manager here, and a lot of my time is spent kind of supporting our student assistance program contracts and working with school districts. Real quick, because before I dive into the work that we do, I just want to give a quick shout out. Erin Piper Townsend's on this call, and she is the Director of Children's Services here at Office of Mental Health, and also Katie Cush, who's a Prevention Coordinator through the Office of Drug and Alcohol. And I'll talk a little bit more in a few slides about our relationship in Montgomery County with the Office of Drug and Alcohol and the work that we've done together. Pretty exciting. All right, next slide. And then here we are, a little flip on the map, next to Philadelphia, Bucks, Delco, and here are our SAP providers. So Office of Mental Health, along with Office of Drug and Alcohol, we contract with 4 providers who are responsible for delivering school-based prevention and student assistance program across the county. So we have Aldersgate, Carson Valley, Creative Health, and Marikey. I really just want to take a moment to acknowledge the work. I know that everybody on this call has been working really hard over the last year and a half to adapt during the pandemic. But just to acknowledge our Montgomery County SAP and prevention providers, because everybody's had to quickly adapt. They have not missed a beat. So just a quick nod and thank you to you guys. Next slide. All right, so one of the things that really makes Montgomery County unique is that our office and the Office of Drug and Alcohol funding sources have been braided to really expand the reach of school-based services that are available throughout the county. So this means for each of those 4 providers who I introduced a slide ago, they've had the capacity to offer a fuller menu of supports to their partnering districts just based on those 2 braided funding streams. So our county, we have 22 school districts, K through 12. The services are available to the districts in all of their buildings, just really based on what complements already existing supports. We have a unique menu. So prevention programming, which is primarily funded through Office of Drug and Alcohol. We're using evidence-based programming that is primarily facilitated through classroom delivery. Program students received include social emotional learning. Second Step is a really big one here in Montgomery County. And it's really important to highlight in the continuum of support because it's a mechanism to be proactive in supporting mental health and wellness at an earlier age. Before a student may even need to be connected with student assistance program in their buildings. The programs available to school districts were strategically chosen in line with a needs assessment that was conducted by the Office of Drug and Alcohol. And then also the really cool thing is because some of them have been so successful and there's been so much interest, we've also been able to secure alternative funding through grants to expand some of that social emotional learning. So there's a lot of really cool projects happening in Montgomery County that even come before a student assistance program. The next kind of batch of services are those county funded services that the staff liaisons are able to support. So attendance to quarantine meetings, consultation to parents and staff, short-term psychoeducational support one-on-one and in groups with students. And then also just another kind of menu addition is through Office of Drug and Alcohol for any supports or students who are referred for drug and alcohol issues. They have access to evidence-based intervention programs like Teen Intervene, Marijuana Brief Intervention, and Dept. And one of the things that's really kind of helpful with that too is as our SAP liaisons are conducting the screenings, right? They have these other options in their back pocket to make recommendations for what fits to that student's needs and the family's needs. All right, next slide, please. So a little bit about the history of Montgomery County. So in the 15-16 school year, we began offering the behavioral health screening tool as the screening tool We do request parent permission. We have a pretty, I would say, decent participation rate. I'm going to say maybe about 75%. Since 2015, we've had a little under 4,000 screenings across the county. A little over 2,500 have completed the adolescent version of the behavioral health screening, and 309 completed the child version. We have seen over time a steady increase with the utilization of the tools. And I'm going to also shout this out, towards the end of the presentation, but just last year, obviously with the pandemic and telehealth, like that switched to be that you all need Tita and Charles to facilitate those virtually and through telehealth with the email links had been so helpful with kind of maintaining that flow of screening process. So next slide. In terms of how the screening is used in Montgomery County, so kind of pre-15, 16, our SNAP providers really had the flexibility to conduct a screening with autonomy. So there was not a universal screening process. Actually, at that time too, we were using the term assessments, and since then that has changed. We are a screening county. Like I mentioned, it's not a requirement, but it's a highly accepted tool that's used. And since we made that transition from 15, 16, I think there's been a lot. Schools know what to expect universally, right, across the county. Like here's our set of services that can be used to complement what's already in your school building, and pretty much no matter which area of the county you're in, it's going to look very similar. Obviously, there are slight nuances with each agency, but it is very much standardized. In terms of how the data has been used, I think one of the really important goals, and I think this is a really important conversation that many people are having, right, is we want to support children who have need as early as possible. So we've been using the behavioral health screening data to understand kind of what the screening relationships have been with elementary schools, or specifically for children ages 9 or younger, so that we can kind of make sure that we're really emphasizing that importance of early intervention. Other pieces of information that we've used is just a data analysis of screening utilization and trends per region. I mean, I think it's no surprise, and Tita, you had this the slide, when we first came in. Anxiety and depression are by far the issues that are identified on the screening tool most consistently. That doesn't necessarily change so much region to region, but it's always interesting to kind of see those other variations in other areas. The other thing that's been really important too, is just, again, this is another piece of data in our back pocket. We know depression and anxiety are a challenge for our youth, and we're really trying to think proactively about, again, how to embed supports in schools where they're easily accessed. So as part of the screening process, or just the STAP referral process, if any high school aged youth are identified as having symptoms of depression that don't quite meet the level or need immediate care or treatment, we're going to actually be piloting the Blues program in Montgomery County this year, which is an evidence-based group program for kids between the ages of 15 and 18. And it really just infuses cognitive behavioral-oriented strategies and kind of teaches them those to hopefully decrease their risk for depression. But again, like the screening data is going to be really helpful, one, to identify kids who might benefit from that program, and then two, just to kind of validate that we're in the right direction with meeting the needs. Other areas that we look at too, right, like the screening tool is amazing. It's also one piece of information that we use to understand how and which supports are offered to families. So through on an annual monitoring basis, our office kind of partners with our agencies to look through a few charts, monitoring the behavioral health screening tool is there. And it tells it a story. So we kind of see what are people coming in with, what are they referred for? And then when it comes down to actually completing the screening, what is being answered or responded to. The other really cool thing I'm super excited about this year is for 21-22, we're going to expand the use of the system offering. So Charles and Tita have put so much time and effort and work into all the different cool capacities of the behavioral health work system. So this year, we're going to be working with them to develop case notes that are more customized to the needs of our county, using that as like an electronic health record, and then also for the JQRS reporting. And we're hoping, I know sometimes it's a big lift in the beginning, right, to like get these things up and off the ground, but that the end result will increase efficiency in our county, and just meet the needs of the staff liaisons as they're transitioning between telehealth and in-person delivery of services, just based on what's happening either in the specific school district or just the time of year, since this is another year of uncertainty that we're contending with. All right, next slide, please. So the COVID impact on SAP services. I don't think there's much that I can say that you all haven't experienced directly, right, with that need to just quickly adapt and figure it out. I think for our county, what we were able to do was a couple different things. So we expanded what SAP services look like to kind of allow a little bit more cushion and support for parents. We know that wait lists right now and last year, you know, were a challenge, and parents need support during this process, either during a screening or as their kids are even referred to their SAP core teams in their buildings. And sometimes if kids are in the process of getting into treatment, it's taking a little bit longer. So there's that kind of psychoeducational consultation support through parents. We also, the providers were amazing with really just helping to ensure that the community was aware about the continuum of support available in the county, including SAP services, but definitely beyond. And one of the things that we definitely experienced was some, you know, kids entering the emergency rooms that maybe there was a place that we could have intervened a little bit earlier, where they didn't necessarily have to have that experience. So our SAP providers during the times last year where maybe referrals from the schools were a little bit slower, they were able to help really be the messengers in the community to make sure that the people knew what was out there. Another thing that they did that was amazing is just, I mentioned that we have the psychoeducational groups, is that again, when there was downtime, the staff were able to create different curriculums so that when students are screened and or referred through their SAP team this year for if there's certain stressors that are identified, the SAP liaisons kind of have all of those resources at their fingertips to hopefully just make it a little bit easier on them this year. And then the last piece is just the time to attend trainings or things that would otherwise be a challenge. So we really, I think, while last year, again, was a challenging year, and I'm not trying to minimize it, I think we were able to try to take advantage of it in some ways to just better prepare us for where we are today. Next slide, please. So in terms of the feedback about the BH Works, again, I think probably if everybody's on this call, it's because they've had positive experience and they want to keep coming back and using it. We're right there with you. It's been a really positive experience. The platform is super convenient, especially with the need for the virtual screenings last year and this year. The data, just having that live data has really allowed some opportunity for objective conversations with students and their families about, like, this might be the reason for referral, but this is also kind of some of the concerns that we have based on the way these questions were answered. And I think for parents, it solidifies the process, right? Where I think sometimes as a parent, it's hard to figure out, is this normal developmental stuff that we're going through, or is it something a little bit more than? So I think for some caregivers that really put people at ease in terms of understanding what they were dealing with and maybe what the next steps had to be, or maybe it wasn't as bad as they thought. And, you know, there's this school support that's available. Kids, I mean, you know, they're like the masters at technology, so they're super comfortable using the iPads and technology and using, and I think it just, right, it gives another opportunity for the questions to be asked in another way. So where some kids might feel uncomfortable answering the questions in a conversation, the device kind of puts an extra layer between that, and they're feeling a little bit more comfortable kind of answering in that way. From a county perspective, I mentioned some of the gains that we've had just from having access to the data, and the county districts having like a universal experience in terms of what a screening really entails. And I'll say it again, I'm just like really excited about how we're going to be using the system this year, because it's really, it's pivotal, right? Like we're evolving, and that's really important to do. Next slide. So in terms of like, if there are any questions about what's happening with behavioral screening or just staff in Montgomery County, shoot me an email. I'm so happy to like talk and share. But I also wanted to use this slide as just a quick time to say thank you to Tita and Charles, just because like you guys have been amazing. So many questions and so many requests personally that I make to you, and you're very responsive with lending your time and just kind of walking me through things that could be helpful for Montgomery County. And it's been really cool to see how this has evolved over time, right? It definitely, I would have never predicted, however many years ago when we started using the tool, that this is where it would be, and there would be a monthly collaborative, and there would just be this much connection. And I also just want to thank Guy, because, you know, he's involved in this process, but also has been an amazing partner to Montgomery County, and we very much appreciate that. So with that being said, are there any questions or anything that I can answer?
Thank you, Charlene. Yeah, that was a great presentation. If there's any questions, please, you can unmute. And I see Carol has a question.
Oh, sorry, I was just clapping.
Oh,
Thanks, Carol.
that's fine as well. Are there any questions for Charlene on her presentation?
I just want to say, you know, it's just been great working with you, Charlene, as with many of the counties. You've just been a great innovator in our space. I wonder if you could take a second, because I think I'm always interested in people knowing, and just say something about the Evolving Police Project. I don't know if have you been involved with that, or has that mostly been Tracy?
Anna Trout is the master of that,
Yeah,
and she's not on this call. So what I'll tell you is Anna does amazing work, but I can't tell you like all of the details of that. I'm sorry.
I'll just say briefly, as again, another creative innovation as part of that adult grant, we're working in Montgomery, trying to use BHS for the police department to use it as a screen to augment when they get a call and go out to a house with a kid and or adult, using the screen in the process to help them decide, do I take this person, where am I taking them, what am I anticipating, and can a link go to the crisis service so that they're more quickly activated in order to help the police department. The whole system's still being worked out. It's a very creative project, but you know, and Aaron are here, and they've been helping. So I just wanted to give a shout out to that.
Thank you. So any questions or comments for Charlene before we move on to the next part of the meeting? And if you think of other questions, you can always put them in the chat, and we can try to get to those before the end of the call.